welcome to Tech Talks, the People and Planet podcast. Today, I'm joined by Tara Donnelly, the CEO and founder of boutique healthcare consultancy, Digital Care. Hi, Tara, how are you?
I'm very well, thanks, Lee, and thanks for having me.
Thank you for joining us. Looking forward to learning more about your background, what you're doing now, the people that you service and what you do for them. So why don't you start us at the beginning of this? You've had a long and successful career in healthcare technology. Share a little more. What's your background?
Sure. Well, I started in the NHS when I was 18. It was kind of by chance. I got a summer job working as a ward housekeeper in a hospital, and I ended up doing that for the whole of my year off while I saved up travelling. And I seem to have got the NHS bug because I've been in healthcare ever since that date, to be honest, in different ways. Most of my career I spent doing operational management jobs in hospitals. I was a director of operations. I then became a chief exec of a hospital. I was also the chief exec of the Health Innovation Network, which is a sort of innovation agency in the NHS working across South London. And that's really when I started doing more in the digital space, seeing the potential of technology to really help staff, patients alike, and the general efficiency of the NHS. I was then the Chief Digital Officer for the NHS, and I was in that role during the pandemic, which was really interesting, as you can imagine. And I started getting involved in care within people's homes. And that's really what my company now does. So 15 months ago, I set up Digital Care, as you've described. There's actually 6 of us. It's not just me. I've got a stellar cast of 6 fabulous women who work alongside. And that's what we try to do, is to help healthcare organisations and tech companies really make the most of this opportunity in digital healthcare.
Excellent. So would you say then that, from your role as the CDO during the pandemic, do you think that was, kind of got the cogs going, thinking, actually, this is where I can go with my business?
It was a really defining moment, I think, for how because most of the time up till then I had worked in hospitals, and hospitals are fantastic places. They're really interesting and challenging places to work. But I feel as though we've gone too far down the hospitalisation as the answer as a society. I don't think it's just the UK. I think that's happening across the world. And that certainly for people who are living with long-term conditions, and 70% of hospital beds will have somebody in it who's got a long-term condition that's got out of control. But the joy is we now have tech that can help us predict that, and technology that can help people manage their own condition much more successfully from home, so they don't need to get so severely ill that they go to hospital. And certainly within I remember really vividly in March 2020, a doctor approached me in my chief digital officer role, saying he was running at the time the biggest virtual ward in the country, but without any technology to help. And he said, is there some technology that could help me? And we were able to partner his need with an offer from a remote monitoring company. 4 incredibly hectic weeks later, that was the first tech-enabled virtual ward in the NHS. And then that model followed for COVID, trying to keep people with COVID at home as far as possible. The joy of these technologies is you can use them for lots of other purposes as well. And the UK has, and it's a kind of quiet victory, not many people probably know this, but there's now in every part of the country, we call them integrated care systems, across all 42 ICSs, there are virtual ward facilities, and they're keeping about 12,000 people at home instead of hospital, but with hospital level needs. And I think that's super exciting. So yes, being part of that is what made me want to work on that full time, really.
Tell us a little more then. Let's kind of dig a little bit deeper into virtual ward, but for our listeners that perhaps aren't quite aware of them or aren't aware of the actual terminology for them. Perhaps they're being treated at home and they don't actually realise. Share a little more on what a virtual ward is.
So I'd love to. So we might hear expressions like hospital at home or virtual wards or digital wards. And what that means is that So, for example, somebody who's had to be hospitalized could leave much earlier by being given often a device with an app on it and a way of monitoring results. It could be through a questionnaire and often through simple medical devices like blood pressure cuffs, pulse oximeters. And those results go to a clinical team who are supervising people. So they're in the comfort of their own home, having a cup of tea on the end of their own sofa, but a clinical team are monitoring them just the same as if they were in hospital. And you can also even get ahead and help people prior to coming to hospital as well. But that's what it is, simple, pretty consumer grade technology, sometimes using people's own devices, sometimes providing them with devices, and sometimes also covering, certainly the company, one of the companies that I work closely with is called Doppler. They will provide the device and SIM enablement so that nobody has to worry about what technology people have at home. Everybody could be part of it. And we are starting to see some brilliant results. There was an evaluation, the biggest evaluation that's ever taken place across virtual wards, reported a couple of weeks ago, 22,000 patients, and they showed they were very successful in reducing emergency attendances to hospital. They save money, and most importantly of all, the public absolutely love them. The satisfaction from patients is enormous.
Yeah.
And some of that is perhaps not what people might expect. So the Health Foundation did a huge study on this last summer. They asked 7,000 people their views, and most people, 78% of people of all ages, said they would rather use technology than go to hospital. When you ask older people, they are even more keen than the rest of us. So over 65s, 85% of them would rather use technology than go to hospital. So any myths we might have out there about who this is suitable
can't
for,
use the phone or anything like that. No, not at all.
Actually, we're not finding that. And possibly that's about that group knowing more about what hospital is like and the downsides, right? The infection risk, the lack of mobilization, the inability to sleep, eat the food you like, be with your network, your pets, your grandchildren. These things are so important, aren't they, when we think about recovery? So that's, I think, really interesting. And 2/3 of people on virtual wards are older. They're older than 65, with the oldest that we know about 103, and rating it as brilliant. The quotes we get back are fabulous.
And there's multiple benefits to this, isn't there? I mean, there's obviously the patient benefits to it. You know, no one likes to go to hospital, really. I mean, and on top of all those reasons that you suggested there, you know, it's anxiety inducing, isn't it?
Yes.
There's the mental health aspects to it as well. You know, you're just in a better frame of mind in your own home, aren't you? I think.
Definitely.
But on the flip side to that, for the healthcare workers in the hospitals, you know, there's a lot going on at the moment about burnt out healthcare workers, you know, not enough beds, all of that sort of things that we heard lots about it during the pandemic, didn't we, in terms of the bed shortages and things like that. And I guess, I do a lot of work out in the US as well, and they're having very, very similar challenges with their healthcare system, albeit it's completely different to ours. But the thread of, you know, better patient care, burnt out healthcare workers is still very much the same.
It very much is. I think across the world, all developed health systems have twin challenges, which are about getting and keeping the clinical workforce and having capacity. And what the joy of this, and the reason I think it's really significant and not a sort of niche thing, but a fundamental thing, is this deals with both. It helps our clinical workforce extend safely to lots more people because they have a dashboard of people. The guy I spoke to right at the beginning, Matthew Knight, who opened the first virtual ward, they saved a full-time respiratory consultant within the first week of opening. And that was because instead of just ringing everybody every day, they could see on their dashboard that most patients happily were green, they were recovering well, they might have even been asleep. And they only had to worry about this very small percentage where their results were out of kilter, so they could devote their clinical time to those patients. So instead of being able to supervise safely 8 or 10 patients, they could do hundreds through technology helping them there. So yeah, I completely, and it's interesting to share things across the globe about which countries are doing interesting things. I was at a global conference recently, and essentially we're all tackling exactly the same issue in different ways. Denmark is very impressive. They have announced that this year they will provide remote monitoring to everybody with severe COPD. That's a very common lung condition. It's the second most common reason of admission for hospital in the NHS. And it's a disease where you can predict and manage exacerbations before the need is there to go to hospital. We're seeing fantastic results with projects we're doing, about a halving of emergency admissions in the group that are being supported, and Denmark has committed to give that to every citizen of Denmark who has severe COPD. I would love the UK to do the same. Whoever wins the next election, I would love us to do a Denmark and do exactly the same, because we move to a healthcare system that is just much more predictable and less crisis-based. And you mentioned bed capacity. The UK has the lowest number of beds per capita across the OECD, so across all comparative developed countries. We are right at the bottom of that. And what that means is that our hospital occupancy rate is unsustainably high, and that absolutely leads to burnout of staff, because it is very difficult to nurse and doctor and to therapist patients when with that intensity is happening about 94 to 95%. With these solutions, you could get that down, restore the calm, do all of your elective backlog and operating lists to get those down too, and the joy is people prefer it.
Absolutely. And that problem's only going to get worse, isn't it? Because we've got an aging population.
Yes. I talked about us having 70% of our healthcare resources are used for people with long-term conditions, and in America that's 90%.
Yeah.
We will go that way, just based on demography and based on population changes in health, and we just need to think of a different way of doing it than the hospital always being the answer.
Absolutely. Tell us a little bit more about digital care then. What do you guys do? Are you focused on the whole virtual ward specialty?
We do particularly enjoy work in that space. We are a bit broader. We cover other aspects of digital health too. But for examples of work that we've worked with rather marvelous brand names in the NHS. We work with NICE, so the world famous organisation that is really evidence-based about healthcare, and we help develop their virtual ward resource so it was as useful as possible to people using their evidence store. We've also done digital reviews for hospitals like University College Hospital. We did a piece to help them future-proof and plan how they their digital health approach, with interviewing lots of staff. That was really interesting. And another piece that we really enjoyed was a piece with one of the Royal Marsden Cancer Alliance. So there are 21 cancer alliances across the UK, and they increasingly have digital responsibilities and digital budget to help improve cancer care. And we've worked alongside them for just over a year on a number of those digital programs, which is really satisfying, speeding up the services to people with a cancer diagnosis. So it's been quite a wide range, but digital home care is the thing that we sort of have a sort of unique level of experience in. So we love doing that work, both with the NHS. So one of the ICSs I mentioned before, Frimley ICS, I've done some work on. They're at the leading edge of what's happening in this space, and they want to stay there. So they're busy thinking about what's next. Similarly with the big ICB in Bristol, which is doing really innovative work. So it's a joy, really. I get to work with people who really see the potential in this and want to make it much more mainstream.
Absolutely. So I think you've been set up now just under 2 years, is that right?
Yeah, 15 months. Yeah.
15 months. It's rarely all plain sailing. With startup consultancies or startup businesses. Any challenges that you've had to navigate? How have you got around those? I suppose, how have you found being in an institution like the NHS when you're working as an employee? How have you found the difference between that and then working for yourself?
Yeah, and a lot of people say to me, wasn't it terrifying? Wasn't that a really scary having worked at the NHS for 35 years. But, it's been a remarkably smooth transition. It hasn't been scary. I think I've always been very entrepreneurial and enjoyed kind of freedom and autonomy. So I have quite a lot of that. And in some ways, I feel like I'm doing kind of the same job. It's just that I'm doing it with, clients of my choosing. So it definitely hasn't felt scary. I think at the beginning, I did have to say, in the beginning, it was just me. And I did have to say no to quite a few interesting things. And that's how my team has grown, is that I was able to bring in associates from across my network, people where we've worked together in the past, who were able to give me more capacity so I could say yes to, and that's been a real joy, actually. I hadn't really, it's not about creating an empire or anything, but it is lovely having a team again. Because we, share ideas, and they're a very impressive set of people. So it's great to work together. But it was a bit of a shame at the beginning when I would try, with interesting work, I would try and pass them on to other people who I really rate. But it is important as well not to. One of the points of feedback I've got from sort of mentors and people I've asked about this is that sometimes people say yes to everything at the beginning, and it goes a little insane. So I was conscious not to do that, because work-life balance is also important. But yes, and I suppose it is more, it's not like a salaried position where you've got complete security. But I'm quite relaxed about that. I think there's enough interesting work out there. So yeah, a lot of people are like, you're so brave. I don't feel like I've been particularly brave, because I feel like I'm just following something I feel very passionate about.
Yeah, absolutely. And I suppose, when you do one project for, let's say, an NHS trust or whoever, you can use that as case studies to, talk to the other ones.
Completely. And I've always wanted to have that mix of both working with digital health innovators and the NHS, because I think that mix is really, really helpful. Now, whether that gets more difficult when there's NHS funding pressures, I don't know, but we haven't seen that.
Do you find there's a culture difference between the ones that are working, let's say, in the private sector to the ones that are working in the NHS?
I think the NHS is such an enormously huge beast. It's hard to generalise. Yeah. So I've worked across 8 different hospitals, and I think they each have different cultures. Yeah. And maybe I've gravitated towards the ones that are very dynamic, but I don't see it quite as. I think some of the most innovative people I've worked with across my career have been clinicians. So it's interesting. I think sometimes there is, well, there definitely is, nobody would argue, but there is bureaucracy in big organisations that can be really tedious. But the individuals, I think, are really quite innovative and want to create change.
It's interesting what you say about that, because I can agree with that as well, because a lot of my customers are even still working in the NHS but have entrepreneurial businesses as well, and are looking to grow those out. So it's interesting what you say about that. What comes next then for digital care? What can you share? More of the same?
More of the same would be amazing. I mean, I've had an amazing first year, and I feel very, very lucky. So more of the same would be great. I think we are looking at partnering a bit more. We haven't really in the past year, but we've been approached about kind of interesting. So, for example, I thought I'd be doing lots of tendering, and I haven't done any so far at all. The work has just sort of come to us. But I've been contacted by a couple of people recently about interesting things where we might partner with others and be the kind of subject matter expertise partner. I think that could be, well, so far it's very interesting. So there might be a bit more of that ahead.
Very good. That's very good. Tara, lovely to meet you, and lovely to learn more about your career and what comes next.
You too, Lee.
Thank you so much for joining us.
Absolute pleasure.
Guys, this has been Tara Donnelly, the founder and CEO of Digital Care. Thanks again.